Okie dokie. Hello, everyone. Welcome again to another edition of Lupus Talks. Of course, my name is Ed Peterson, the host, the co-producer of this podcast here with Dr. Calvini Williams from Lupus of Nevada. Guys, you can want to support and check her out at her website at lupusofnevada.org. You can also go to the YouTube channel, like and subscribe, of course. The YouTube channel as well, as she continues to share tools and tips and information that's going to be relevant, that's going to be referencing, helping patients that have lupus, family members of people that you know who are suffering from the autoimmune disease, what is going to be relevant to contain and maintain a good lifestyle for yourself. And when we have a support system, if you're not supported by anybody at this moment, you can be supported at Lupus of Nevada. Go to the website, fill out the form of your information, and we'll be happy to answer any questions you may have, or you want to be a part of this organization as well. So we have that too as well. So we want to look forward to continuing sending out support to you on a regular, consistent basis throughout the year 2025, as we're now moving into our third quarter of the year, which is going to be the month of July, the seventh month. We only have 5 months left after that of this year, 2025. Time is flying by, and we're still continuing on with our assistance of helping as many people as will give us the permission to do so. So with that, I want to take it away, Dr. Williams.
Hey, thank you, Ed. I appreciate you. Today we're going to be talking about, first of all, I want to say thanks to everyone that has helped Lupus of Nevada. I don't want to ever leave you out. My co-host is at her granddaughter's graduation in Seattle, so she's not going to be able to be with us, but she sends her love. At this point, I'm going to talk about, which I think is so important, clinical trials. Black folks don't do clinical trials. I'm just going to say they're scared. And I think the actual example of that is Tuskegee. They're scared. They always remember that and how no one helped them. They gave them that drug, and it turned out to be syphilis, and they were going to give them the antidote, and they never did. So we've got a lot of our people that have been told that and have been raised up to hear those stories, and I know that's a major part of it. Okay, so from the Foundation of America, Lupus Foundation of America, we're going to be talking about clinical trials and trying to educate people on these clinical trials so they know what they're getting into, and they started off with, which I think is wonderful, John 3:1 and 2. John 3:1 and 2. Beloved, I wish above all things that thou mayest prosper and be in health, even as thy soul prospereth. That's John 3:1 and 2. John 3:1 and 2, and I love that. Now, through improving minority participation and awareness in clinical trials, which is called IMPACT, IMPACT for lupus, the Lupus Foundation of America and local faith communities have partnered to shine a light on clinical trials and to educate about lupus. Lupus is a disease that affects African Americans, particularly women, at much higher rates than others. In fact, 1 out of 250 African American women will develop lupus in her lifetime. Not only is lupus more common in African Americans, but fewer African Americans participate in clinical trials, and that is so important. Again, that's their choice. I can't push anything on them. That is their choice. If they choose to do that, I'm hoping they do the best for themselves. They make the decision and see what happens. Now, as I go through this, keep in mind all these areas of information. Go back and talk to your doctor about it and see what's good for you and what's not good for you. Talk to him about it. Clinical trials are studies that can help doctors and scientists learn more about different diseases and discover better treatments. As an African American, participation in clinical trials is very important. And the reasons why it's important, because African Americans participate in clinical trials and it's historically low. historically low. I want to tell you guys that. Let me put this back up here. Historically low. African Americans may respond differently to certain treatments than other racial groups. Many of the current medications and procedures used to treat lupus have not been fully studied in African Americans. Participation allows you to take an active role in your own health now and for the future generations. The impact of lupus, which is what they call the clinical trials, they call minority participation awareness in clinical trials, which is called IMPACT, is a model of the impact for lupus model was developed to create awareness and education program to help inform you about clinical trials and lupus. It was created to participate with family, physician experts, clinical research participation experts, key lupus research community experts, and lupus patients. Impact for lupus was also developed using an extensive literature review and information gathered by surveying the faith community, bringing the community in. I think that's excellent. Again, no one is pressuring anyone, because we have our disclaimer on this show, this podcast, about go and get a clinical trial. We're not. We are basically educational awareness and advocacy. That's what we do. We give you the information so you can feed it to your doctor and see which way, see what's good for you and what isn't good for you. It's always good to have information in your mind so you can think about things. At least be informed. If you're not informed, that's a major problem right there. The model features a navigator as a connector among physicians, patients, and clinical trial teams with local faith communities. Faith teaches us to think of others and leave a legacy of good works. Participation in clinical trials is one way to do that. Now talking about the impact for lupus. Lupus is a devastating, complicated disease, as we know, that knows no racial or ethnic boundaries, but is especially severe in African Americans. It is devastating because African American women develop lupus at a younger age with more complications. I just had a major complication. I'm not of that age pregnant, but I'm saying it knows no boundaries, none. I couldn't hardly do anything. I couldn't raise my arms. It still hurts. I was having pains all in my left arm and my right arm, and nobody knew what to do. Now, my doctor now is sending me to, to look at my bones, to look at that shoulder and see what's going on. But lupus attacked my joints, and that's what it did. And I lost lots of weight from that. As you can see, there's a lot of weight that has left my body without taking dietary pills or anything. It just left. Then it says, awareness is a critical and necessary first step for anyone considering participation in clinical trials. I know for a fact, won't mention names, but one clinical study was paying lupus participants money every time they came in to do the clinical study. I think that's wrong. It's wrong. People were talking about, they came back to me and told me about it. And they were in there saying, where's my $40? Don't tell Calvinia, don't tell Dr. Williams, because she's going to be mad at us. You know, and they went in there after the money. Now, in a clinical study, if I am correct, and please correct me, everything is secrecy. You have to sign a form. You get into the clinical testing at your own. What's it gonna say? Just slip through my head. At your own risk. Okay, at your own risk. So, if I were you, I would look at other studies. Look at other studies and see what the individuals, the reviews, what has come out of the reviews. Awareness is a critical and necessary first step for anyone considering participation in clinical trials in my arm. Impact for Lupus is a 1-year grant awarded to the Lupus Foundation of America by the Office of Minority Health as part of a larger federal initiative. The National Health Education Lupus Program. The goal of Impact for Lupus is to develop the test, innovative education model, and faith-based communities to raise awareness of lupus clinical trials among African Americans impacted by lupus. You want to know everything about this, everything. Where is the last buck going to stop? Who's getting paid? Who isn't? That's very important. And I say that to you, not mentioning any names because we would be in a world of trouble. But look at every situation and look at every participant. Communicate with those participants in there. Find out what, when, how. The bottom line is who's getting paid. Who's getting paid? Who is actually getting paid for you to be in there and taking that shot? Now it's the other shot. The other thing is test is blowing in your nose. I can't mention the name of that one either, but you guys can look it up and see the last clinical study they were doing on this major drug for lupus. They said from August 16th to June 17th, the Lupus Foundation of America and its partners developed the faith-based education model and materials for African Americans with lupus. The model features a navigator as a connector among physicians, patients, clinical trial teams with local faith communities. The model was implemented and evaluated from September 2017 to December 2017 in 3 sites. It was developed in Georgia, the Georgia chapter of the Lupus Foundation, Charleston, South Carolina, in collaboration with Medical University of South Carolina, Fort Washington, Maryland, and collaborated with Carleton Incorporated. The impact of Lupus Action Partnership as of September 1st, 2017, includes the following representatives: a patient, clinical trial, lupus, and industry experts. They had a variety of names here that participated in it. Please look it up on the Lupus Foundation Clinical Studies. For additional support, they tell you to contact the Lupus Foundation of America educators and ask questions, because that's the only way you're going to find out about this. You got to ask questions. You can't just, say, because someone told me. Someone told me. And I think that is a bad way to go out of this world. Someone told me. You have to be perceptive. You have to go after what you're going after and make a difference in your lives and other lives. Now, they've got videos of people that are on these clinical trials. I suggest you look at that because that is important. They have a new study published in Lupus Science and Medicine. Researchers assess clinical trial perceptions among a predominantly Black cohort of participants with systemic lupus erythematosus. I have that. You probably do too. They have social determinants of health are also associated with wellness to participate in trials. Among Black respondents, willingness to participate in clinical trials was associated with being male, unemployed, or disabled, having governmental health insurance, and experiencing higher disease activity. Now, we suffer from emotional, how should I say? I suffer emotionally, when I see my therapist, because there's a lot of things going on in my mind, a lot of pain, a lot of this, nobody's doing what they're supposed to do, nobody's looking at me, and that's very important. You go in there and tell the story, and they say, okay, we'll talk about that later. No, you're going to talk about it now, because I've been dealing with it for 2 months. So with my doctor, which is excellent, they're having me come in tomorrow to test my oxygen. Now, I have an oxygen tank plugged up to my wall, and one of them said to me, well, this is what we'll do. We will take the condenser out of your house and give, no, you won't. That's my lifeline. If I can't breathe later on, I mean, at nighttime, my mouth gets dry and I start breathing hard, I have to have that huge machine right next to me, right next to me. That machine has been with me way before my dad died, probably for 15, 16 years. And that's my lifeline that I need, because our lungs are infected with a lot of things. I just say lupus affects the lungs. And that's what they told me. It affects the lungs, the breathing, the this, the that. There's a lot of things. And that's why I said you have to be educated on your own merits to find out all this. Also, Lupus Foundation of America is committed to advancing lupus research, improving clinical trials, education, addressing health disparities through initiatives, um, like the Research Accelerated, which is your RAY registry. The RAY registry empowers individuals living with lupus and their caregivers to contribute and experience and use their voice to advance lupus research and improve clinical design and education. What I can tell you is to study, research, 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 research. Because if you don't, you'll be hanging out there with one toe on. You know, I know that sound. That's just me being, funny. One toe. And you want to know how you got that one toe left. Your body is your only body you have. Try to be the best about your body. And when I say be the best about your body, look at your body as though it's a diamond. Diamond in the rough, a yellow diamond, an emerald. Look at it. Because that's the only body you're ever going to have here on this earth. And you need to make sure that you are doing what is right. I don't condone when the folks call me and say, well, Calvin, I'm drinking Cavassier and I'm smoking this and I'm snorting that and I'm doing this. First of all, we pray. Because I really didn't want to hear from you talking like that. If I wasn't prayed up, I'd have hung up the phone. But people like that need help. So you have to listen to them. And that's what I've done, is listen and listen and listen. To the point that they've educated me. And they've educated me to help them and help myself. Because there's no need of harming your body when you know you have these issues that you have to deal with. Other people, like the foundation and other individuals, they're trying. They're trying to help us. But first, we must help ourselves. And with the racial disparities in mortality associated with lupus, systemic lupus, they talk about health disparities in lupus from the Lupus Foundation, systematic lupus, a chronic systematic autoimmune disease, and often non-specific symptoms. Those are very important. You got to read. Racial disparities in mortality associated with, let me go into this. This is from CDC. Always look for CDC, Center of Disease Control. What is already known about the topic systemic lupus? It says, it used to say you had 5-year survival rate for patients with SLE, but it's improving. How can you tell me I'm only going to live for 5 years? And I've been living for 26 years with this disease. How can you, that's not bragging, that's just saying thank God for that. How can you tell me that? But we've had parents that talked about it. I remember my mom and the family, aunties, and them were in the kitchen. That's where they did. That's where the old folks, old African Americans, mothers went in the kitchen. They were cooking and talking, and we couldn't go in there. That was their private moment. But I was able to hear Mom say, did you hear about Mary Jane? And they said, what? They said, she died of something called systemic lupus. Now, Mama was a nurse, and she came into our place, and she died. They did not have what they have now to help us. And those doctors are out there working their hands off to help us. I tell people now, I was in the rate of getting angry because I didn't think they do enough. But how can they do what they how can they do enough when they don't have um, enough clinical studies, enough materials? They don't have enough of that. Look at Africa. You know, we had brought someone over here from Africa in 19, I think, what was it? It was about 9 years ago. And in, what was it, Trina, um, they thought she had AIDS and didn't want anything to do with it. So her brother, and through the help, I just say no, through the help, I keep giving glory to God, but through the help of Bishop Tutu, we were able to bring her here, send her to a clinical study, and that was in Maryland. We sent her there. She stayed 2 years in that clinical study, and then she was able to go back to her country in Africa, I think it's West Africa. She was able to go back to her country, her world, and help them. Now they've gotten better standards, better this, better that, and I'm trying to contact individuals in Africa to see what's going on. I've already been able to contact people in the UK, but I just want to see what, get some information of what they're doing and what we're doing, That's very important, to look at others and try to improve yourself by finding out what they do, and then give it back to your doctor and say, well, this is what they're doing in Africa, and this is their new clinical study, and this is that. And that will give him opportunity to research it for himself. He can bring it back to staff and to other doctors. They go on to say, what is added by this report is using improved methods by following SLE patients carefully, defined as a population-based registry, standardized ratios were 2 to 3 higher in persons with SLE than in the general population. It's very important. What are the implications for the public health practice? These are questions that they have here. The current CDC supported efforts to encourage early detection, diagnosis, treatment, and to enhance self-management skills that might mitigate racial disparities and improve overall outcomes in SLE. Let me break that racial disparities down. A lot of people have lupus and they don't have the finances to help themselves with this disease. They may get Medicaid, Medi-Cal, maybe Medicare, but they have to work really, how I want to say this. Medicaid and Medi-Cal get something different than Medicare. The things I ask my cousin, the co-host, the things that I get, she doesn't get. And that's the limited amount of the medical line that's drawn between her and me. So they have to look into all of these, be cognizant. Look at your dental, look at your hygiene, look at your dental situation. A lot of teeth come up missing, Try to talk to your doctor about that and try to make sure you clean things up. Take care of you, because you're the only you in this world. Now, current CDC supported efforts to encourage early detection, because it used to be 5 to 7 years, and it mimicked other diseases in our body. They go on to say, and to enhance self-management skills, which I said will mitigate racial disparities, and we talked about that. Let's go on to the, I don't want to give you too much stats and this and that, because it takes me time to figure it out too. And I have to really research it, and I know you would too. So we're going to go on to another area. And, okay, I talked about improving that, lupus African Americans. If you have any questions, please leave them for us to answer, because this is a short time for us being on here, but leave them for us to answer. We would love to answer those questions, and we'd love to hear from you. We want you to, excuse me, to follow and subscribe to our channel so we can continue to help our folks, giving them information on clinical trial outcomes, African American lupus treatment. We're talking about Native American Indians. You were talking about Asian. You're talking about a lot of Americans that, the minorities that have these issues, and people don't want to bring it to pass. So you have to be that person. You have to be that light in the tunnel to say, hey, wait a minute. You got to help me with this because I don't know where I'm going. They say the state of lupus clinical trials minority participation is needed. They're begging for people. In the United States, the reported prevalence of lupus is 100,000 to 500,000 patients, but all over the world it's 2.5 million. No, it's 5 million. Take that back, because it's been 2.5 million since I've been here in Vegas for 20 years. It's 5 million now. Lupus affects minority populations, including African Americans, thank you, Lord, Latinos, and the association with disparities are substantial. Women are at a higher risk, in which we are. They go on to say that African Americans, Latinos compare non-Hispanic whites. Let me go back over that so we know both what we're talking about. Women are at a higher risk of lupus than men, and lupus prevalence is the highest in African Americans and Latinos compared to the non-Hispanic whites. African Americans and Latinos also have increased disease symptoms, severity, experience more lupus, related complications, and have a 2 to 3-fold mortality rate compared to the non-Hispanic whites. Lupus clinical trials offer opportunities for quality care and can result in new treatment options. Somebody had to go through the clinical situation with the prednisone that we have now. Someone. Again, I'm not pushing you in this. I'm trying to educate you and tell you where to go get the information. Because just because one person gets it, a friend gets it, oh, I got paid for it. You need to research this. You need to have a communication with your doctor to find out what his thoughts on it. Because, it's like my doctor has to sign off on me going into something like this. Because he's treating me and they're treating me. What's going to happen? If they tell me to stop taking certain medications that I'm taking now, there's a problem. Because when I go back in there and say, I'm not taking any of your medications because a clinical trial told me not to, that doctor's not going to work with me because he's scared of a liability suit. He's scared of malpractice, So you have to be aware that both you and your physician are in the same category as anything. So again, like I said, it's almost 2:30. We've been on here half an hour. Is that right, Ed? I guess he's still there. And just read this. I mean, it's complicated to me, but I've walked through it. And those of us that have lupus are walking through it. Nobody can walk in our lupus shoes but us. Nobody can tell us, well, you need to do this and you need to do that. If you're not hurting like I'm hurting, if you can't get up out of the bed, if you can't raise your arm, if you can't open your eyes, because I think I told you that before, way back when, in the 1999 or 2000, my vision was impaired. I couldn't see. I was blind as a bat. And the doctors came in and told my dad, my little son at that time, he wanted to go. My dad said, let him go. That's his mama. And they buddies. They buddies. And she's a single parent and he has to know. So they told my dad, I don't think she'll ever be able to see again. I don't think she'll ever be able to see again. So I take my eyes very, very, they're very, very critical for me. I take care of them. That's what I'm trying to say. I take care of them. I don't sit up under a 90-inch screen TV. I won't do that because that's going to hurt my eyes. I watch when I'm looking at the screen and try not to spend 8 hours a day on the screen. And if you do spend more than amount of hours and you're on that screen for 3 or 4 hours, take a break because I write books. One of them is Chris and Christina Have Lupus, which is a children's book. The other one is coming out. I'm going to let Ed tell you about that because there's some good books that are there and my mind is buzzing because I have 2 more books online that I have to finish up. and I have to finish that up. So everything is running in my mind. But you have to be the person to be the marshal in your territory and do this. Ed, are you still here? Thanks everyone for listening to me. And I know I kept talking and talking and talking. Again, go back to Lupus Foundation, to their research site. Look at everything I talked about: clinical trial guides, research studies, clinical research, current clinical trials. Thank you so much for being a part of Lupus of Nevada, Lupus Talks.
All right. Thank you all for this edition of tuning into Lupus Talks. We're going to be doing this again every week, ladies and gentlemen, so that way you can get information that's fulfilling and that is going to assist you in your endeavors and what you have to do. Again, if you have any questions about it, you can ask Calvina Williams. You can go to our website at lupusofnevada.org. You can fill out the form on the website, and then you can check out information that we have as well. You can always look at additional content on the website as well as on the YouTube channel. You can check it out at Lupus of Nevada and reference to that on YouTube, and as well as on the Facebook page as well, Lupus of Nevada. You can like and subscribe on the YouTube channel, and then of course you can like us on Facebook as well. So with that, we're going to continue our series of that as we close out the month of June already. Man, this month has went on by, ladies and gentlemen. So we just got to keep it moving, keep it grooving. And if you have anything that you want to share or inquiries, again, that you have, just go to our website and you can check us out. We'd be happy to assist you. Any questions or anything you might want to share.
Mention that book, Ed, about loving God while living with lupus.
Oh, yes. Okay, yeah. So you can also get the book, purchase the book by author Dr. Calvina Williams, Loving God While Living with Lupus. And then you also have Christina Have Lupus. There's another book that she has written as well. So you can go and check those out. Share that amongst your family, friends, and everyone, and your coworkers, so that way they can also learn about it and just listen to the story that is being told. Because again, it's going to be something that's going to be impactful and something for you to utilize and share amongst your friends and family. So with that, I want to thank you all for this edition. You guys have a great afternoon and keep the faith, ladies and gentlemen, and keep building your dream.
Thank you. Thank you.